Hey leaders, this is Jeff Garrison with Results on Purpose. Welcome to our YouTube channel and the podcast. Normally, I am just delivering some leadership wisdom in just a few minutes, but on occasion, we have a good story to tell. So we have a guest and we do more of a long form podcast, which is what we're doing today. Today, we have Paul Abel from Poster Elite in San Diego. He is the CEO and founder of that company. Welcome, Paul.
Hi, how are you, Jeff? Good to see you.
I'm excellent. So y'all might notice the date that this is being done. We are, right at the beginning still of the coronavirus pandemic. Obviously, there's a lot of stuff going on. We're in our homes today, like everyone should be. And that kind of sets up the story a little bit. Paul is doing something extraordinary for the medical community in his area and around the country. And we want to talk about that here in a little bit. But first, I just want to give y'all some quick background. Paul and I got to know each other in 2016 when I started coaching his leadership team. Can you believe it was that far back? That sounds like such a long time ago, Paul.
Hey, it's only 8 quarters ago, right?
Yeah, well,
or 12 quarters, right? What is it?
Yeah, it's and that's
quarters.
Funny because that's the way we think. We think in terms of quarters at Results on Purpose. But at any rate, real quick, when we started working together, Paul had about 42 employees in his company. You were knocking on the door of about $3 million in revenue at that time. And after about 9 quarters, we had our implementation. And at the end of the second annual planning meeting, they were zeroing in on $9 million in revenue, not quite there at the time, but they had cut their staff down to 14 employees. This is an incredible story. Tripling the size of revenue while cutting staff in 1/3. And I just wanted to share that background because I want everyone to understand that one reason Paul's here with us is because he is an extraordinary leader. So you'll take that compliment, Paul?
Hey, you know what? It just means that you don't know a lot of people if I'm the guy.
Yes.
You got a lot more people to meet.
It was those few years, it was just an amazing ride, seeing that happen. And we could spend a whole afternoon breaking down everything that occurred at that time, all the challenges and opportunities. But it's definitely not why we're here today. Like I said, I just wanted to give a little background there. But why we are here today is that well, y'all know in the pandemic here, there's a huge shortage of medical masks. And Paul has stepped up through connections and just his own ideas to try and help solve that problem in the community. So, Paul, I just tell the story. How did this get going and what has happened to date?
Excellent. Well, thank you, Jeff. I appreciate the compliments, and I'll start just where you started. And before I tell my story, is that none of what not my story. What I'm in the story is not over.
That's
I think
right.
The story has just begun. But I think that something that I'd like to just mention is the way that I can really mobilize and get as much done with as few people is based upon a very simple recipe. And the recipe is the few people I have, I call them super employees, okay? They are the best. They are all A players. Every single one of them is outstanding at what they do. Secondly, with your help, we did Strength Finders. You trained me on what Strength Finders is. So I select employees. I don't hire. I select employees. I select partners based upon what I feel the need is going to be. Thirdly, is all these tools and all these seminars and all these books that people read, they read it for entertainment, or they read it to get motivated, or they read it to get inspired. I use it as an instruction manual.
Absolutely.
I use it as 100% instruction manual. I am no way the smartest guy in the room. Most probably my IQ is lower than most people out there. And because of that, most probably I have the ability of really learning and understanding what to do and how to do it. So that's the feedback to, whoever's going to be watching this. I have no college degree. I was a terrible student. And, I found in my late 40s how to learn and how to do this. It's something I'd like to share, Jeff, and then go into it. So what I do is I first get a summary, and I listen to a Blinkist, and then I get the concept, then I buy the Audible. Then once I listen to the Audible, then I buy the book. And then once I read the book, that's when I make my notes. And this process for people like me that have ADD, ADHD, dyslexia, and every other learning disability, as it's been quoted by the establishment, really is an ability to get the information into this head. But once it's in there, then all these ailments, the dyslexia, the ADD, the ADHD, turns into a super weapon. And the super weapon is able to do a lot. So that's just something I'd like to share. A big win for me is how to digest the information. You use a Blinkist, a summary, Audible, read the book, put it to action. And then get a coach. Get a coach. It's a, you're a great coach for me. I have other coaches as well in my life that are amazing. And even the best athletes in the world, and no matter how good they are, and they get to the top of their game, they're still going to hire a coach. So that's on the business side. So the other thing on the business side, before we go into my passion project right now, is it's really important to commit. So if you're an owner or you're a manager or leader, if you're not the person committing, if you're not the one that actually performs better than anybody else, whatever new system you put in place, then go and take the money that you're going to spend and buy masks and give it to doctors. You're wasting your time. So it starts with you. And most owners and most people that I know are afraid to step up and make changes, and they rely on their team to do it. No, it comes from you. The commitment is yours. Set the standard. And that's something that I see a lot of people that get involved in. They say, well, this doesn't work, or this guy's not a great coach, or, this didn't work. My business is different. Rubbish. They just didn't commit. So that's my 2 cents worth, is commit and hunker down.
Yes. So what you described there, Paul, 2 concepts that we use. One is extreme ownership, right? When you talk about commitment, we're talking about taking extreme ownership over your own development and your selection of people and the results that you get. So you take extreme ownership over those things. And something else, when you talk about the books and the learning, they're all business growth, or all growth in your family or in your church. If you're the leader, it is preceded by your personal growth, your personal development. If you don't develop, your business won't develop. If you don't develop, your family won't develop, and so on. So those are just great points to bring up, Paul.
Thank you, Jeff. And, with your help, we've made amazing things happen. And now I'm using what I'm going to call these superpowers and these super employees, and the way that we run our business so agile, for a cause that I had no idea that was going to be assigned to me by a higher power. So some higher power somehow found this guy, Paul Abel, and said, hey, it's your job, right? So I'll go into that part of the story. So we also own so the company has 3 divisions, and one of the divisions is in the OSHA business. And what we do is we help employers, maintain a safe environment for their employees. And that includes by different postings you got to put on the wall, first aid kits, and other personal protective equipment. So I have through the OSHA side of the business, I know how to procure first aid supplies because it was a big part and still is a big part of what we do. So what happened was, the story goes into getting back into entrepreneurs. So how does an entrepreneur do? Entrepreneurs are the first people that will turn a crisis into an opportunity. When everybody is running away from the fire, the true entrepreneurs are the ones that have capabilities and know what to do in a crisis, run into the fire. And when you're in the fire, you know what is happening and how big it is or how bad it is. Because when you're running away, you're not looking behind you and you'll fall off a cliff. So entrepreneurs are the first, and you said something now. Entrepreneurs are the first to provide the leadership. This is an opportunity for the entrepreneurs to step up and do what they do best, is be the leaders out there. It's amazing how few leaders there are. Everybody's waiting for the other guy or the other gal, and nobody's stepping up. Nobody's owning it. So I'm giving you that part of it. So where does this happen? So in a crisis, people rise to the occasion. There's something with, I think Warren Buffett says, with his investors, he says, you really know who you're dealing with when the tide runs out and who's naked. Because everybody talks a good game, right? But who's naked and who's not, right? So this has been an interesting journey because I'm with all the training that I got from you as a coach and other coaches, I've been uniquely equipped. So let me start the story.
Yeah.
My brother is a pediatrician. He owns multiple practices up in Orange County, California. Amazing physician, in addition to businessman, affiliated with Children's LA and other hospitals, and amazing guy. And so he heard what I was doing. And the first thing I did when the crisis happened, and one of the things I'm really happy about, is that my son, who recently graduated from college, from the educational system, got to see what the entrepreneur does, right? And so he saw this firsthand. So what happened was when, there was panic out there. There was panic out there when all of a sudden the virus hit the US. And I do want to mention that I knew this was coming because, I lived for many years in Israel, and I have friends in France and Italy. And, I'm on these WhatsApp groups, and they've been on lockdown now for a month, right? So let's put it this way. They've seen the movie. The first release of this movie was in China, and then the second release went to Italy. From Italy, it went to France and Israel. So I saw the movie happen, and I knew, oh my God, this is going to come here. This is going to come here. And this is 2 weeks ago. The date today is March 28th, 2020. So this is 2 weeks ago. So I sat down and I hunkered down, and I basically came up with a concept, and the concept was get your workplace ready for the pandemic. Okay, so what that was, it was a package of posters based upon CDC guidelines. So it was a poster set, how to keep a clean office, how to recognize the symptoms, what to do if somebody's ill, and basically just really Lego easy cartoon type English and Spanish postings. But I also, by reading the CDC guidelines, it was important that the person at the workplace, if they were infected or they were coughing, nobody knew about COVID-19 then. Yeah. It was ask that employee to put a mask on and then leave and go see the doctor. so that way it's not spreading. This was 2 weeks ago. So I bought 100,000 masks, and my distribution, I think we are helping over 1 million businesses in the United States right now, helping them keep compliant with various manners or, in our HR products.
Yeah.
So I bought 100,000 masks for the test, and basically created this kit, which was provide a safe environment for your employees, right? Get ready. Well, guess what? The Get Ready campaign disappeared the second day that I launched it. And it was, oh my God. Now it's keep your current employees safe, right? But basically, same deal, and it was still the same kit, and we started selling a few of them. Then I'm obviously very close to my brother, and one day he calls me up. He says, Paul, you won't believe this. I don't have any masks. I don't have any. I think he employs something like 30 doctors, and he has 150 employees in his multiple practices. He says, Paul, we don't have masks. Again, what do you mean you don't have masks? I mean, this is Children's LA. It's his practice. He says we don't have masks. So my son is in the house now and graduated from college. Put him in his car. He went and he took one of these. I had 3,000 masks available, and drove it up to my brother's office to put the masks, to give his people masks. So when I did start this campaign, Jeff, it was absolutely, I bought the mask because I had no idea it was going to spread like this. And it was basically a prevention deal. But then what happened is he informed Children's LA that, hey, he has masks. So then I get a call from the CEO of Children's LA. Can you get us masks? And I'm going, of course, I've got some inventory. I'll make it happen. So immediately I recognized, oh my God, this is a problem, because this is the CEO of Children's LA calling me. And we gave them inventory of masks. Then I get a call from this guy, Johnny, who's my CFO. His sister is in New York, and she's at NYU, and she's basically begging her dad to get masks. So now all of a sudden I'm shipping masks to NYU, and then I get a call from one of my clients that's out in New Orleans, and he says, hey, we got hospitals. So my warehouse now, I'm depleting all this inventory that I had, and it's basically at the stage where, I'm not even worried about the money, because this is our frontline people. These are doctors in the front line. So now all of a sudden, I'm getting all these phone calls on a Friday night. We had the head of the emergency room in Cedar Sinai Hospital calls me, and she's a friend of the friend. She says, "Hey, I heard you have masks." So okay, my phone's ringing off the hook, and I basically said, "Of course I can help." And basically, I was getting overwhelmed, and that's when I contacted one of my favorite clients out there, Renita Best from Southland Data Services, and she's an angel. And I said, Renita, I need help. Can I connect you with Cedar Sinai? But I'm going to ship you the mask, and then can I use Southland Data to help me distribute these to your clients that are in the healthcare frontliners. So kind of long story short, I gave 10,000 masks to Renita, and she distributed them to Cedar Sinai, UCLA, and other hospitals. So now all of a sudden I get a call, and I pick up the phone, Kaiser Permanente. I mean, this is the head of procurement for Kaiser Permanente. Wonderful guy. He says, do you have masks? Right? Okay. So these are our medical institutions.
Yes.
So now I'm going, okay, I'm running out of my inventory that I purchased, but I'm obviously seeing that this is dire. Okay. Now I have served in the Israeli Defense Force when I was living in Israel, but I've never ever served in the United States, army or military. And if I was living here, there's no question I would have. And I said, this is the best country in the world. I've done amazingly well over here. It is a fantastic, unbelievable place. And it's the least I can do right now is maybe I'm being called up to serve. Maybe
Yeah.
this is my calling, and taking my background. I was a combat medic, by the way. So I was a combat medic, and I understand how what the needs are frontliners from previous experience. So now I'm running out of masks, and everybody's going to China looking at masks. And this was, again, I'm talking about maybe 5 days ago, 6 days ago, before the testing, okay? This is before the testing, so pre-testing, okay? So I have a factory in Mexico where we do production. I think you work with John over there as well.
Yeah.
And, I've got connections out in our facilities there. And I basically, out of, our personal accounts, my wife and I, we sat down, and every year we do, contribute a lot towards different causes. And we said, okay, we're going to go all in. And this is our annual budget is going to go towards this. And I procured more product out of Mexico, brought it in, and just distribute to various doctors out there. So, so where this all comes into play is I'm still designing. I have to run my business. I have to keep my existing business going. In addition, I'm now the mask guy, right? For these are major institutions. So how did I do it? So first, of course, you go and pray. Right. Make sure you do it right? So how did I do it is I engaged our, my wonderful clients out there, that we partner with. Jeff, we work together and we have these groups these mastermind groups. And really got the support from them and the encouragement from them. And through my creative ways and my international contacts, I found more masks. So I just brought them in. Now, I don't have the N95 masks that everybody's looking for, but I've got some coming in. They're leaving. I think they left China 2 days ago. It's being shipped directly to Cedars-Sinai, directly to, it's 1,000 masks, I believe. And Cedars-Sinai, is going to be receiving them and checking them. And if it works, Jeff, and these masks are good, because I don't want to just get any product out there. There's a lot of fake stuff, and you don't want to be in that game. And so I had it, I basically financed everything and made sure that Cedars-Sinai gets their lot. So I'll know hopefully by Wednesday if the source is good, and then I got access to 100,000 masks at that stage.
Okay. So how many, when you total what's already been committed and what you think having come in, is 100,000 the total, or are we past 100,000?
We passed 100,000, and we haven't started yet. And by the way, I don't think we started yet. I mean, I think we're going to need another 1 million masks.
Yeah. Well, keep them coming. So it's interesting. Tens of thousands into the 100,000s of masks coming from China, coming from Mexico. And I've shared this story with a few people about how extraordinary it is that with the weight of our federal government, we can't get masks. And here's this guy in San Diego that has what we call an activator strength that, gets an idea, and Paul, everybody, as an activator, is physically incapable of sitting on an idea. If he has one, he's gonna run with it. And this is one of those things where he just started figuring out, who can I call? What can I do? And he made it happen. And this is why we're talking. This is one of those leadership talents that this is what's unique about Paul. You don't have to have this to be a great leader, but this is how he is a great leader. Gets an idea and just moves. He deploys his the great people around him. He calls up his contacts, but anyway, tons of masks coming from different countries into the country, and then using his own clients to give this away and to distribute them around the country where things are needed. It's just extraordinary. You're a true patriot, a true American, the whole bit. And, obviously it's been an honor to work with you. It's an honor to continue to do things, and it's an honor to tell the story because it's just amazing. That's kind of it in a nutshell. Is there anything else you want to share, Paul?
Yeah, absolutely. So now it's getting, I think I'm in about personally over $100,000 right now of our own family money towards this. And Jeff, I'm afraid that it hasn't started yet, based upon my friends living in Europe, and we 4 weeks behind them. Okay, so Cedar Sinai has created a GoFundMe account, basically in order to collect money from the community in order to help procure, for our frontliners. And again, I'm very sensitive. I was a combat medic, and God forbid, you're doing unbelievable things, saving people's lives. But what happens if they're gone, right? Who's going to save us? So it's our job, it's our duty, it's our calling. So I'm thinking about it. Maybe Jeff is putting another GoFundMe account together, for our payroll industry clients, or our safety clients, or whatever it may be, and just to be able to generate some income. And then all I want to do is connect these sources, because it's the entrepreneur in me, right? I'll get stuff done. I don't go through the front door. You know me well enough, Jeff. If everybody's running in one direction, I'm going to find a window to go through. And I found them. I know how to do this. And I can get millions of masks. Now, they're not cheap. Obviously, China's figured out it's a commodity, and, they're taking advantage. Please God, there won't be a problem in May and June. But if we want to get masks tomorrow, we can't put them on a boat and wait for it to be in a month. It has to be air freighted. This is air freighted. So it's so these masks right now are landing between $3.50 and $4 a piece. And these are the N95 masks, the ones that everybody needs. Again, I'm buying them for Cedar right now. But if it works, I got access to another 300,000 of those. That's 1.2 million bucks, right? Or $1.5 million. And that's now it's getting above and beyond my pay scale. But that's
well, let's get the link to the GoFundMe. We'll put it in the notes here. You'll find it on our YouTube channel. We'll post that stuff along with whatever marketing you do to get that out there. But so we'll put that link up if you're watching the video and can spare a few bucks, help put a dent in, what we're looking at is over $1 million. That would be appreciated.
And again, I want to be very clear. I am not making the opposite. I'm in the hole over 100K right now. This is not a time to make profits. This is a time to help. And something else I'll share, Jeff, because I have this attitude of basically being out there and giving and doing selflessly. You have no idea how my business is doing so much better. My employees are saying to me, we need to hire people, because what's happened is all of a sudden, people are recognizing us. We're not just a vendor. We're not just a company out there that wants to get your money. We really are partners to make things happen. And then we also, we created this product, which is about 9 months ago, we launched it. And it's a platform. It's called the e-Poster service. And it's the digital distribution of mandatory labor laws to employees. And I built it for a very large PEO in the country. And we have about 60,000, 70,000 users on it. Well, we knew that remote employees was going to be the future. We didn't know it was going to happen in a day.
Yeah, not like this.
In a day. So we're actually giving away the platform for free. through our clients for 90 days. And the reason we're doing that, Jeff, is that employees now have to also receive all these notices of what to do and what their rights are. Because in the past, we'd ship a poster, right, to the physical location that had all the state and federal labor laws, city and county. Well, the employee, we're not going to ship posters to employees' houses. So the Department of Labor did, recognize that the electronic distribution of these notices is acceptable at this time. And we have an amazing platform. It's going to be free through our clients and, for 90 days. And, we're absorbing all the costs to do this. We think we'll have 20 million employees on our system in the next 90 days, Jeff. So what is the business model in this, Jeff? Is that give it away for free. Don't profit when people are hurting. Do not profit when people are hurting. If you go out there and you help when people are hurting, I'm only hoping 10% stick on my platform when everybody goes back to work, and then we got a great company. So I'm not looking for dollars today, and I'm looking for the future and to our job is to keep people employed. If people are not employed, if employers cannot keep people employed, then it's dire. Anything we can do to help employers, anything we can do.
Of course, one other thing about great leadership I'll mention, and then we'll wrap it up, is that without integrity, you can't be a great leader for the long term. And the things that you have just described just betrays the integrity that you have. It just shows everybody who you are. And so again, it's another great example of leadership. It's all about, in this little time that we've been talking, someone can watch this and unpack just a lot of stuff that they should aspire to. And I thank you for the time, Paul. It's we've taken a Saturday afternoon to get together for this and get it done. So thank you very much for that. We'll spread the word.
Thanks, Jeff. And I want to just say the last word. It's every citizen's obligation to ensure that first responders, doctors, people on the front line are safe. It's our duty. It's our duty to do that, whatever we can.
Yes, it's to our detriment if they don't stay healthy, that's for sure.
You got it. Keep well, Jeff. You're the smartest guy in the world to be on a farm in Iowa, all by yourself, and with your cattle and your chickens and your shotguns.
That's right. We are isolated out here. This is our social distancing plan for sure.
You're social distant by 40 miles.
Right. That's right. All right. Thanks a lot, Paul.
Keep safe, everybody. Bye-bye. Thanks.